It is good to note that there are emerging and re-emerging issues in society, and especially in our neighboring countries. We already are experiencing an outbreak in M-Pox in our country today, and we already have 41 cases that have been confirmed. We have heightened our surveillance at the border. We have equally heightened our screening. Yesterday I visited Jomo Kenyatta International Airport, where we have more than 24,000 travelers that pass through that port of entry alone. Therefore, if it is combined across the country, you see that there are very many travelers that come into our country. We have beefed out our screening to ensure each and every person is screened at every port of entry. We have about 26 ports of entry in the country, and each one of them is manned by our port health officers, and they shall continue doing their work and also building capacity on the stakeholders who are likely to have interacted or contracted M-Pox from other people. We are talking about hoteliers, we are talking about truck drivers, we are equally talking about commercial sex workers who come into contact with various travelers across the board. We are also very keen about Marburg and Ebola. Marburg has been discovered in Tanzania, and we equally have Ebola in Uganda. These are our neighboring countries, and it is good to note that diseases have no geographical boundaries. So anytime we may experience this kind of diseases in our country, but because we can prevent the same, we are ensuring that our borders are tight, and we are ensuring that anybody coming into the country is screened of those diseases so that we can protect our citizens and we can protect our people. I would love to caution the mothers who are breastfeeding, and at the same time they are taking shisha, they are smoking, they are taking poaches, they are taking a local brew that we have in our communities. It is important to note that whatever you take, and either you're breastfeeding or you have the child in your tummy, then that child continues to feed on the same. We are equally championing screening at the bottom of the pyramid, ensuring that people are getting checked their blood pressure, blood sugar, and also reminding the caregivers and mothers that they need to take their children for injection at the right time and the right doses. Equally, today we have had a conversation with the mothers and those who wish to become mothers in the near future, that SHA through Linda Mama through SHA is free for the mothers who are pregnant, that they need to go for their prenatal care, they need to go and get checked during delivery, and they equally need to go and get checked after delivery. That SHA, Linda Mama in SHA is enhanced in the sense that we are taking care of mothers before they even deliver.